A 10-year-old boy is brought to the pediatric emergency department with a 2-day history of fever, abdominal pain, and vomiting. On arrival, he appears lethargic and pale. He has had decreased oral intake and reduced urine output. His vital signs reveal you suspect septic shock and initiate a fluid bolus and antibiotics. However, her clinical status remains unchanged. You order blood tests, including an arterial blood gas and lactate level.
Question 1. What does the elevated lactate level indicate in this clinical scenario, and how does it relate to the patient's current state?
The elevated lactate level suggests tissue hypoxia and anaerobic metabolism, commonly seen in shock states, such as sepsis.
However, lactate can be elevated not only due to hypoperfusion, but also because of adrenergic stress, decreased hepatic clearance, or other metabolic factors. In this patient, the elevated lactate supports the diagnosis of septic shock and ongoing global oxygen delivery and demand imbalance. After initial fluid resuscitation, you decide to assess the patient's central venous oxygen saturation. To further evaluate her oxygen delivery and consumption, you insert a central line, and the central venous oxygen saturation is found to be 69%.
Question 2. What does the low SCVO2 suggest about the patient's current condition? How should this guide your management?
And central venous oxygen saturation of 68% is below the normal threshold of 70%, indicating that the patient is in a state of decreased oxygen delivery or increased oxygen consumption. This could be due to hypovolemia or decreased cardiac output leading to inadequate oxygen delivery to tissues.
Management should focus on further fluid resuscitation to improve perfusion, consideration of inotropic support, close monitoring of central venous oxygen saturation, to ensure that oxygen delivery improves with resuscitation. You also order a base deficit to assess the patient's metabolic status. The result shows a base deficit of -8 m EQ/L.
Question 3. What does the base deficit tell you about the patient's condition, and how does it compare to lactate as a marker of shock?
A base deficit of 8 reflects significant metabolic acidosis, indicating the presence of shock and hypoperfusion.
Base deficit, like lactate, is a marker of tissue oxygen deficiency, but it may be more sensitive in detecting early shock ***, and predicting resuscitation needs and mortality, especially in trauma. In this case, both the elevated lactate and significant base deficit point to inadequate tissue perfusion and persistent shock, despite initial resuscitation efforts. The base deficit can help guide further fluid management and the need for other interventions, such as blood products or vasopressors.
Despite fluid resuscitation and broad-spectrum antibiotics, the patient's lactate remains elevated, and her central venous oxygen saturation has not significantly improved. You are concerned about the possibility of over-resuscitation, leading to complications such as pulmonary edema.
Question 4. How should you balance fluid resuscitation with the risk of over-resuscitation in this patient, and what other markers can guide ongoing therapy?
The Pediatrics Surviving Sepsis campaign recommends using lactate levels as part of a comprehensive perfusion assessment, but overemphasis on lactate normalization may lead to over-resuscitation, especially if fluid overload occurs.
In this case, since the patient's lactate remains elevated and her clinical status has not fully improved, management should focus on